BPPV is perfectly treatable by the patient themselves, because you just have to move the head through a certain set of positions depending on the canal that's involved and depending
which is the Epley Maneuver.
And Epley is one of those maneuvers. It depends on which canal. Epley is for the posterior canal, or supposedly perhaps an anterior canal as well. But there are other maneuvers which are just as effective. For example, if I have someone who has come to see me, but maybe they live a long way away, or maybe I've tried them, I've seen them a few times, and yes, the treatment helps, but it keeps recurring, in which case I want the patient to be self-treating, then often rather than an Epley, I will tend to give them a Semont Maneuver, because it's simpler than an Epley. It only has 2 positions as opposed to 3, and it doesn't involve tipping the head back into such a sort of extreme extension rotation position. So it's a little bit safer for most patients. So yeah, you could give that. I think a lot of people get given these things called Brandt-Daroff exercises, which again, for treatment of BPPV. But I have to point out that for BPPV, they're absolutely useless. They are physiologically incapable of clearing crystals from the canals of BPPV. So
what were they called again?
Brandt-Daroff, and they're fairly typical. Brandt-Daroff. It basically involves sort of turning your head one way and lying down onto one side, and then coming back up and turning your head the other way and lying down the other side, and you repeat that. And all you basically do is you kind of slosh crystals from one side of the canal to another, and it doesn't really achieve anything. So if people get better doing Brandt-Daroff exercises, it's probably just time and giving them something to do whilst nature takes its course, which is nothing wrong with that. That's a good thing to do, but it's not the movement which is clearing the problem. So I wouldn't bother giving those. But some of these other self-treatments, as long as physiologically they're draining crystals out, then yes, they're fine.